At Starlight, we would call ourselves the leading charity for play in healthcare in the UK. Our focus is to work to bring together partners to do what we can to avoid trauma for children who are engaging with healthcare, and health play is the primary way that we do that. We are so excited to be able to share with you today the summary of the amazing work that has been happening across the country. So the Health Play Innovation Awards was an initiative to really bring together the pockets of fantastic practice that practitioners across the country are engaged in to save resources, to improve the experience of children and their families, to find efficiencies. And these small pockets of practice where they are happening should not be kept in isolation. So our main driver is to bring these innovations out into the open and to make sure that as many people as possible can see and experience the wonderful work that is happening. So we're going to have some fantastic presentations from practitioners today. Just to say, we are going to be quite tight with time. So I'm going to challenge you, speakers, to stick to between 3 to 5 minutes. I'm going to set a timer and make sure that you have a 3-minute warning that you can see, and then I'm going to draw you to a close at 5 minutes. The reason that we're being so strict today is we really want to have opportunities for questions and for interrogating the amazing work that has been happening. So we have planned for 6 speakers, and hopefully all 6 speakers will be with us. Anybody who would like to really sort of find out a little bit more about what you're hearing, please do feel free to add questions into the chat. It will really help speed up our Q&A section when we get to it. So without further ado, and please do note that, you know, just sometimes when I have headphones, I could accidentally turn my microphone on. So please do be careful just to make sure that you are muted whilst the presentations are happening. Without further ado, I'm going to hand over to our first innovator. And we are delighted to hear from St David's Hospital. Please introduce yourself.
Hi, good afternoon, everyone. My name is Irene Hancock. I work in Cardiff and Vale University Health Board. My work is based in St. David's Hospital. I work as a community support worker, working with young people aged 18 years and below who have problems with drugs, alcohol, well-being, and mental health. Some of these young people have learning needs such as ADHD, Tourette's, autism, and others. Some of them have been bullied in school and in the community. Others have been physically or sexually assaulted. Thank you.
Hi, my name's Andrew. I'm the National Clinical Specialist for Children and Young People at Spire Healthcare. I'm based at Spire Manchester, and we do elective surgery for children and young people, mainly day case, but we do have some inpatient activity, and we have a heap of clinics supporting children in an outpatient facility as well. Thank you.
I'm so sorry to interrupt. I'm just going to, I don't know if it's got a little bit lost in communication perhaps, but just going to, if it's okay, skip back to Irene. And Irene, if you're able to talk a little bit about the innovation that you submitted to the Innovation Award, that would be great. We're going to kind of do one speaker and then move on to each one. So if you're able to talk a little bit about the work that you submitted to the Innovation Award, that would be great. And then we'll move on to Andrea and other people as well. I'm so sorry if that got a bit lost.
Okay,
Thanks so
no problem.
much, Irene.
That's fine. What I find helpful and beneficial with Starlight resources that I received is I get to improvise and innovate to suit my young people's age, because most of them are 14 to 18 years old. Most of the resources I received from the resources boxes are for younger children, so I have to improvise so that the teenage group that I'm working with will not feel put off by the activities that we do whenever we meet face to face, whether at their own home, in the community, or in school, or in the hospital itself. And I just want to mention about the young person that I worked with, where I innovate this activity. She she was 16 years old at the time we started the session. She wanted to end her life after being dumped by her boyfriend, because the boyfriend found out that she was pregnant. But after much persuasion, to meet in person, I told this young person that I have set aside green Thai chicken curry for her. It's like a bribe. Because she doesn't want to meet me, and she's making loads of excuses. But then I set aside some green Thai chicken curry for you that I cooked last night, and cauliflower rice. So can we meet? So I made it a point that with all the goodies I received from the resources box from Starlight, I set aside some cuddly toy, some chocolates, and jigsaw puzzles, and crossword puzzles that she can work with. These also to cheer her up. So we made some personalized bracelets, and improvised by making um, trolley earring. And then during our ending session, this young person told me that she still uses her trolley keyring whenever she goes food shopping. And that is, sorry,
Go ahead, Irene. Go ahead.
that is in a way for me an appreciation of not just the activity, but the time spent with her during that lowest moment of her life. And when I discharged this young person, I saw some positive changes in her. She gave birth to a healthy young baby boy. And then the other resources that I received from Starlight are the lined notebooks.
Mm-hmm.
So I am fortunate because in this community that I work with, there is a facility for young people to be able to cook and bake.
Mm-hmm.
So the lined notebook that I received, my young person and I wrote the recipes of the food we cooked, like the green Thai chicken curry, the seafood sushi rolls, the cakes we baked, and smoothie we made. And at the end of our session, they keep all this recipe book that we made together, and all the stickers. So they design their own recipe book. So that's how I innovate, just to suit the resources that I receive for these young teenagers. Because like what I told you before, most of the resources that I receive from the box were like suitable for younger children.
Mm-hmm.
So I try to make it appropriate for their age group. And then the other one is the multicolored dough and clay I receive. What my young person and I did with it, we flattened it with the use of a rolling pin and pressed a maple leaf and cut it out. So we let it dry, and then the following week, when my young person and I met, she took it home and she used it to keep her rings and her handmade bracelet.
Wonderful.
Another thing that I received from the resource box is the Uno card
Hmm.
games. I had a young person, I think he's only 14 years old, male, who was diagnosed with ADHD, and he is
Hmm.
smoking cannabis.
Hmm.
So we use Uno because he very much enjoy playing Uno, but I also improvise by using it for a game of Snap. And he said, "Ooh, that can be used as a Snap."
So
So he was,
you found the resources were able to help you make a
yes,
connection with
because
him and bring some joy.
yes,
And I'm
yes.
just going to give some context. Thank you so much, Irene, for sharing those stories with us. And for context, the process of the Innovation Awards required that case study information to be sent in and filtered through a panel of judges, and they were particularly struck by how you adapted the use of these toys to help you to work therapeutically with these young people with complex, challenging needs. And so, um, this work is so fantastic and so creative. And I'm going to um, stop you there and thank you very much for sharing. And now, May, can I just check? Do we have somebody here from Spire?
Yes, that's Andrea there. Yeah, all good.
Yeah,
Wonderful. I'm going to hand over to you, Andrea. You've got 5 minutes. Thank you so much.
lovely. So in the independent sector, we launched VR technology. So we worked at Spire Manchester to implement VR goggles for our young people that used our facility and also our adults that use our facilities as well. We did a lot of kind of probing work and a lot of challenges, let's just say, came across. Our doctors weren't that in favour of it. The families sometimes didn't appreciate the benefit that the VR technology could bring to them. It was more a case of they just wanted to get in and get gone. But we kind of worked on the premise that a young person's first experience of healthcare can actually set them up for life. And by improving that first experience, potentially with us, would improve their experiences of healthcare for their duration of their time, really. And ultimately and eventually, we did manage to win over both our consultants and our anaesthetists who perhaps weren't so in favour of it. We did sessions with them to let them have a play with the VR goggles, and that they really engaged with that. And then the feedback that we received from families was really exceptional, and we were able to use that feedback and those case studies to we originally, I didn't say at the beginning, but we had it on a trial originally, but we were able to use those case studies and those really positive outcomes for the young people to be able to actually purchase the goggles that we now own and use across the board in the hospital, really. We found that levels of anxiety were really reduced. Young people actually preferred using the VR technology during phlebotomy procedures than having any local anaesthetic creams or topical anaesthetic. It's been really supportive for children having minor procedures, and we do some MRI scan prep work on it as well with young people who are perhaps a little bit too old for sedation but need some support to get them through the scanner. So it has had a really positive outcome on our service and our children's needs and experiences. I don't know if that's 5 minutes, but
Andrea, you still have 3 minutes if you want to take the whole 3 minutes. We'd love to hear more.
I've been what else can I say? So I can give you some case examples. So we had a young lady, she actually was 14. She came in, she had a phlebotomy procedure done and had a very, very poor experience at a sister site. So not here at Spire Manchester, but at another site. She'd had a very poor experience and the phlebotomy hadn't been successful. So she came over to us for a second attempt, and we used the VR goggles. We did some prep work with her and her mum, and we spoke took probably quite a lot of time to do a phlebotomy appointment, but the outcome was that she really engaged with the goggles. She absolutely loved the videos that she could watch while she was having the phlebotomy done. And after the phlebotomy had been done and we'd successfully got the blood from her, she just was so complimentary. She had said that she didn't want to come to the hospital because she was really very scared about having another bloods done because of what had happened previously. And we kind of changed her mindset positively for us and the outcome for her, but potentially negatively because I appreciate that not everybody's got VR goggles. So she she was really complimentary of our innovation. What else have I got on that slide there? We've used them to prevent children needing pre-meds. So they've worn the VR goggles to go down into the theatre and into the anaesthetic room and be successfully anaesthetised without needing a pre-med, which obviously adds to their kind of patient safety journey across the hospital. And I think if you click on a couple of slides, there's a few comments from actual children that have used the VR goggles, and so that's one little boy using them. We had his permission to share his photo, and that's our CYP team here at Spire Manchester. And then if you click onto the next one, I think there is some. So yeah, so the little boy at the top there said it was amazing, 5 stars, super duper. 1,000,000%, he said. Virtual masks for this top one here, the virtual mask was amazing and calmed my daughter down so she could have her bloods taken. That was the young girl that I was just talking about. She was very anxious when she arrived. Absolutely amazing, great alternative and a great tool for distracting anxious patients. So that was a mum who had come in quite anxious with an anxious child, and we actually let the mum use it as well because she was concerned about what the child would see on the VR goggles. She didn't appreciate that there was so many restrictions in it. And we have an iPad linked to the VR goggles so we can actually see exactly what the children are watching. So yeah, it's been a really positive asset to our service here at Spire Manchester.
Andrea, thank you so much for sharing that. We absolutely always love to see the evidence-informed approach and to hear children's voices through that feedback. And you really have touched on there some parents' worries as well and how you've overcome that. So thank you so much. And obviously the judges were very impressed.
Thank you.
So there will be time for questions for both Irene and Andrea. So if you've got those bubbling, please do put them in the chat. Next, we would like to hear from you, Katie. So Katie, you are working at UCLH and your work has all been about efficiencies with MRI preparation. Tell us more. Katie, just to say as well, May is doing a fantastic job sharing the slides, and whenever you would like her to move you on, please just say.
Perfect, thank you. Yeah, if you've got my slides, that'd be great. Thank you, May. So hi, I'm Katie. I'm the Deputy Play and Youth Manager at UCLH, but clinically I work as a health play specialist in imaging and nuclear medicine. Yeah, next slide, please. So the innovation I want to talk about is our imaging service. So it pays to play. So this has been a pilot study since 2014 and it's been growing year by year. So why we made the changes to the imaging service the way we did it. So we were scanning more and more children and young people. So the demand was increasing. There was not really a standardized pathway. We wanted to improve patient experience. We were getting inappropriate referrals for GA. We were seeing an increase in waiting times, and we were wanting to support children more with additional needs. And obviously in supporting with bed numbers and the lack of capacity in the hospital. So because of the use of the pilot study, we went from having a 12-month trial of a band 6 HPS and to now we have to today where we have 1.7 whole-time equivalent band 6 play specialist permanent, which is really fantastic and means we have been able to branch out to other areas of imaging, not just MRI. Next slide, please, May. So what is the role of the HPS in the imaging department? So we make assessments assessing obviously whether a child needs a GA or is a non-GA, prepare them for the scan, but also support with that treatment. We see a lot of children at the beginning of their oncology journey, so that gives us a good indication of how they manage scans, how they might be in terms of compliance for the rest of their treatment. Provide support for the patient and family, act as a link between the MDT. We have really close relationships here with the MRI superintendent, and that helps us to really be a part of that pathway and make sure the patient and family experience is as positive as it can be. Provide training for the staff and student radiographers, speaking at conferences, normalising the environment for the patient, ensuring it's really child friendly and appropriate, and most importantly, creating that positive experience. Next slide, please. So a lot of these kind of resources will be familiar, especially to play specialists, but using models that are familiar and are helping a child to really understand what they're going to experience. So using miniature models that can replicate the sounds, preparation books, really taking the time to understand the child's needs and how they learn best to make sure that they can get through that scan as best we can. We also work really closely to have desensitization sessions on the scanner. So if we have enough warning, we can book those in with the radiographers to really give that child the time it needs to be used to the environment and ensure it's as smooth as possible. Next slide, please. So the efficiency, how we've improved efficiency essentially. So as I've mentioned, by reducing the amount of patients that are required to be in admission, we're obviously reducing the cost of anaesthetic, minimising the risk, and also building resilience for children and young people, as I mentioned, about going through their treatment. But we know a lot of our children we meet might have ongoing and regular scans, so if we can get them through, it just helps establish those coping strategies early on. Freeing up beds, reducing waiting lists. There's a case study I'll quickly share at the end, which is a great example of that. And if they have effective preparation, we're less likely to reduce, we're less likely to waste slots. Yeah, next slide, please. So what was the key to the success of this innovation? So champions, as I mentioned, working really closely with our MDT. We've got some great radiographers that really understand and respect the role, which means they can understand and vet through the referrals we get. So we know what appropriate ages are for general anaesthetic, so it means every child age 4 and above is immediately referred to a play specialist and placed on a paediatric MRI awake list, unless anything's been disclosed at their clinic appointment that would mean differently. Good communication, having that set standardized pathway, and the prep work at the beginning, which I'll explain in a second. Next slide, please. So how do we do it? So we have a referral system, which you can see on the right. So how our team can get in contact with us. We have a shared mailbox, which means that any clinician that wants to refer a patient to the imaging team can use that mailbox. And we also are very involved in contacting the families with the team to book them in for virtual prep clinic, and also just go through any questions the families may have. Next slide, please. So the impact of this innovation now means that we are running 2 awake lists every week. So we are seeing up to around 12 patients per week awake. And because of the success of this, it's now branched out to other areas of imaging, so supporting in CT, nuclear medicine, fluoroscopy, and ultrasound. Next slide, please.
1 minute left, Katie.
Okay, I'm almost there. So as I was saying, the MRI virtual prep clinics have been something we've introduced in the last year, and this has just really supported efficiency in the experience of a patient. Instead of just going through preparation on the day, we've established these clinics now, which means it's less of a rush on the day. The patient can get more detailed and advanced preparation before they come in, and it means the radiographers can really focus on doing their role of the MRI safety questionnaire, and actually the child can just enjoy being in the environment and not rushed onto the scanner. Next slide, please. And that's the case study I was just explaining about. So this child meant, because of the impact of the prep and the support that he had when parents were quite keen for a GA, it mean he had his awake scan 6 weeks before he should have done if he was on the GA slot. So when it comes to a diagnosis, that's hugely impactful. So next slide, please. And just a bit about radiographer education, how we get them on board. We're embedded in their induction, so they have information about the role, and we also get involved in simulation sessions, which are a great example of how we get involved as well. Next slide. And that's just some feedback. I think that was all. Sorry, I whizzed through those. Thank you if I went over.
That was fascinating. Thank you so much, Katie. So clear. Um, that sort of moving through testing and trying something out, and then moving on to teaching your colleagues, being involved in simulation. Absolutely brilliant. Thank you so much for sharing. Um, Again, as a reminder, if you have questions bubbling, please do put them in the chat to help us to synthesize those. I know I have plenty already. Um, so, Katie, thank you so much. We're now going to move across the country to Nottingham, and I'm handing over to, I think, Carol and Kate to talk about using play to support children who need non-invasive ventilation.
Hi, yeah, my name is Carol, and Kate is in on the team, but she's on sick leave at the moment, so
Great to have you, Carol. Thank you.
Going solo. I work with the long-term ventilation team here in Nottingham, and Kate is an OT that we work very closely as a team. We can have the next slide, please. Thank you. We have a group of children who need non-invasive ventilation, which is where they wear a mask, and ventilation at night. And it's become very evident that there are quite a few of the children due to their complex needs, etc., that become very non-compliant very quickly. So historically, they would come into hospital for 2 weeks, and they would attempt to set them up on non-invasive ventilation. It meant they were using a bed, they were taking nurses, they weren't in their own environment, and it really wasn't an ideal environment to be in. So we approached the MDT team and suggested that maybe if we got involved as play and OT before they even introduced the NIV, we could do it through play. I involved Kate, the OT, so that we've got a real holistic approach, and that we could look at the complex needs children who had sensory issues, that I could utilise Kate's skills as well. Next slide, please. So a quick case study. This is Lorenzo, normally we work with children in the community, and we actually go into their homes or into the school to do our prep work. But for Lorenzo, he had surgery, ENT surgery, and it was discovered that he actually was quite critically sick, and that he was not going to be safe to go home without initiating NIV. He was autistic and also had pica syndrome, which is where they eat non-edible objects. And he was fit and well during the day, but it's unsafe for him to be not monitored at night. So the challenge was to try and establish him. We were in an environment which wasn't the normal intensive care environment, because they were closed for refurbishing. So it was a really, really strange environment. He obviously was very, very active during the day. But we knew that if we couldn't get the NIV on, he would end up needing to have a trachea, which obviously has big implications. He would need to be moved, probably rehomed. He would spend a long, long time in hospital, and that wouldn't be cost effective for anybody, and it certainly wouldn't be the most appropriate journey for Lorenzo. We actually, through using stories, which is our innovation, we use personalised stories. So as you can see by the picture here, Lorenzo, I don't know if you can see that he's got Spider-Man stickers on the mask. So we decorated the mask he decorated the mask. What we didn't realise at that time was that he had pica syndrome, and so when we came back the next day, he chewed half of it. So we had to adapt it and get a different mask to fit him that he wasn't going to eat. And we made a story for him. Kate is incredibly at devising stories, and together we bring up decide what area we want to focus the story on, and then Kate writes these amazing stories. So this was a story about Spider-Man needing masks. So we really link in with each individual child with what is their focus, what their interests are. And we managed to get him using the ventilator with his mask on within 2 weeks, which was, we felt incredible pressure due to him not being able to go home without it. And we couldn't have done it without his mum. The successes that we have are where we've got the family involved completely from the beginning, and that they are, we give them the tools and they're the ones that have to, we're not there at night when he goes to sleep. And she was phenomenal. And as I say, we got him established within 2 weeks and he went home. He's still using it now. And mum is just incredibly grateful to us. Next slide, please. So some of the interventions that we use is that, as I said, those are personal stories. These are the two so Elephant's Windy Day, we tend to use as a first one, which talks about just blowing on different parts of your body. And then the individualized ones. And then the last picture shows a little homemade ventilator that we tried to provide for them. And improvising using the old tubing and things, we managed to find something small enough, a mask enough to fit on Spider-Man, and that goes down very well too. Next slide, please. So we've done the pilot for about a year now. These figures are slightly out of date. I've had actually 5 referrals this week alone, and we have got the backing of the MDT amazingly. We've got now consultants referring us before they come to the LTV clinic, and we're able to go out and actually introduce it completely before the nurses or any of the medical staff actually get in contact with them. It's still a work in progress. We're still tweaking it as to when's the right time to introduce the mask, because we need the nurses there to correctly fit the mask. So we're still working with when that right time is. But the feedback has been incredible. We've got a really good LTV team who are completely behind us. Parents, I think doing it in their own home works well for some. We've been into schools to just initiate that initiation. We are discussing whether we start doing evening sessions so that we can actually be there at bedtime, so we can help with that routine and getting them established as they're going to bed, because obviously we see them when it's not bedtime. But that is a work in progress.
Carol, this is incredible. Another incredible innovation. You know, everything you said about how you've worked with others, how you've been able to adapt, and of course that life-changing intervention there, because for children like Enzo, it's about being able to live as normal a life as possible. So that is wonderful. Thank you so much. Again, I know that there will be lots of questions just around how you've managed this, what your barriers have been, if any, what your challenges have been. So please do sort of synthesize those if you're in the webinar. Carol, we will come back to you. Thank you. So from Nottingham to Manchester, I believe I'm handing over to you, Susan.
Thank you very much. Hello, everyone. Yes, I'm Susan Fairclough from Royal Manchester Children's Hospital, which also includes our site of Withenshaw site, the children's ward and the unit there, North Manchester site, children's ward and unit there, and also our Trafford site, the children's ward. At the moment, there's just me here. I think Jill couldn't make it. I'm just checking she's on the call, but I don't think she is, so that's fine. But what I'll do, I've got quite a few slides, but I'll kind of go through some of these. I'll just explain an overview because some of them are quite in a bit of detail, so I'll just kind of go over them. But you've got them then on this recording that you can actually read them and see them at your leisure. So it was really the fact that we've had a health play specialist linked to radiology department now for over 28 years. And it's been fantastic seeing the work that the play specialists do in radiology, and also what we've seen at other hospitals like UCLH, many other hospitals as well, and also the Evelina. I think it's great that I can see over the years that many people are helping children and young people to have the MR scans who, you know, were meant to be sedated and they got them through awake. And also seeing the practice that a lot of people are using the same tools, like, for example, we do use models, and those models can be like the Philips prototype that looks like a little miniature MR scanner and makes the noises of the scanner. We also have the Lego model as well. We also have other wooden models which were designed for MR scans and CT scans and things like that, and also lots of photographs and visuals. And we do use VR headsets, which was great also to hear from other hospitals using those, not only like for distraction but also preparing children. And there is one on there of preparing someone for an MR scan. So it's great that I can see that we share those kind of practices across the country, which I think I love coming to these type of meetings, and these we celebrate. That's a lot of great work that we're all working together on together. I think what came from this innovation was also, besides actually us getting like rocket scanners, which patients can go on and practice on those scanners, felt that there was a lot of work that we've done over all the years that we wanted to kind of make it a little bit more data crunching, and we also wanted to actually show the benefits that having preparation for the scan for all the different age ranges, with children with complex needs as well and special needs, and how we can get them through to have scans awake. So what is balancing between obviously the patient experience and at the same time to keeping them informed and letting them actually have the scan awake as well. So what I'll go through some of the slides to give you an idea of the kind of work that we've been doing, because although this has been going on for many years, I felt as though we wanted to kind of bring it out there of the work that we're looking at. Child of any age, we're looking at I think looking at the nurse-led sedation, play therapy input, and what they do regarding feed and wrap as well. So we know that we're able to get to prepare children for scans younger, under like the age of from 4 and above, because of the actual having a rocket scanner as well, which is going to help. But also we've also looked at the age of 3. We're actually looking across the whole age range, because there's a variety of patients who can still actually utilize some of these tools that we do use. We've got a variety to help different abilities and different age ranges, and it's actually the health play specialists who work in those areas that actually do that. From this project as well, we've identified that we needed more than one health play specialist, and at the moment we've got 2 health play specialists linked to our radiology department, who actually do help to cover on the other sites as well, because of where our radiology departments are. But fortunately, we have got health play specialists within clinical areas on the wards in departments across the 4 sites, so that if they're actually preparing a patient for a scan as well, that they can actually take the patient through that journey of preparation as well. So I think rather than going into all these slides, because there's quite a lot of detail, what I'll probably do is just, if you don't mind, just going through each slide, and then you've got them on the system to see. This was kind of the weekday provision. We were looking at the weekend provision. That was we've got some figures here regarding the sedation issues, and then there we go. And then a little bit where it began. Now, although this is where it's began just recently, it's because what we wanted to do is actually increase the patients coming through who would actually not need sedation. And so with doing that with all the clinicians and with the radiographers, we've also working on this also with our innovation team. So as I go back to having a play specialist in the area for 28 years, it's been great that a lot of good work's been going on, as is in many other hospitals. But I think it is so important that we have that research, we have that data that can actually measure the benefits, but also we've got the feedback as well that also measures the patient experience, and all that together is something that in everything that we do is making sure that we actually identify that we know play is important. We certainly know that play makes a difference. We certainly know that it works across all age ranges. But it's the more information that we have out there, that's data, and we also have patient experience, it is better. Just recently, we had a figure that 80% of patients who were planned to have scans sedated, I think it was 82%, were able to have scans awake. So that does make a great big difference to the patient experience, and also that was successful through the preparation, and they were converted to awake scans as well. There is more up-to-date slides, I must admit, and I did say to May that we have got more up-to-date information since we did this presentation, but this just gives you some idea of the little journey. Do you go to the next slide? It might give you some more.
I just want to say, Susan, this is incredible. 82% conversion rate of children who were able to have their scans awake. Incredible. If you are possibly on your last slide, I think that would be brilliant.
Yeah, I think we are where we are now, and some future plans. And I think there may be another slide after it, unless that's the last one now. I've not got I think the next one. Yeah, I've just does this a bit, like I say, it's useful to have these number crunching information, and we've got a lot of things that we've, data that we've got, just to show that I think it's important that when we're presenting this to a variety of professionals, it's so important that play is on the agenda, and the importance of a registered qualified play specialist being in the post is something we put forward. And as the others have mentioned as well, we're involved in the teaching sessions, education about the roles, and also we do get referrals on a system called Hive, which is a documentation system as well. So we do get many referrals that come through for this, not only just for the pilot, because we've got a lot of numbers on this, but we also have all the other patients that come through for having scans as well. So I'll kind of wrap it up there, because I know there's lots of other people who've got lots of more great information to share. I'm conscious of the hour, so but you've got the slides as well, and if there's any more information of any update that you want me to give you, then I will be happy to do so. So thank you.
Susan, thank you so much for sharing. This is incredible. And I hear you talking about how you have taken the inspiration from the data that had and the innovations that have happened in other places, and then gone on to further that work and contribute more evidence. So you're just, this work, particularly considering the number of sites that you work across, is incredible. Thank you so much for sharing. I'm so sorry to have to squeeze you just a little bit, but I know there'll be lots of questions. Thank you, Susan.
Thank you.
So back to London, we have another representative from UCLH. Geraldine, are you there?
Hi, yes, I am.
Amazing. Handing over to you.
Hi, I'm Geraldine. I'm a play specialist currently covering the theatre list at UCLH. Can you go to the next slide, please? Thank you. So we're currently doing both different type of lists, like dental, ENT, urology, gynae, and every other list, like add-ons that come into the hospital for the peds. So we work with children 0 to 18 years of age. And what I'm going to be talking about is our neurodiverse list that we cover. So when a child has a neurodiversity, during their pre-assessment, the pre-assessment team go through an all about me with the patients and their parents, just to say what kind of like anxiety they have, what we can better do to help them on the day of their surgery, their triggers, what they like, what they dislike, and that helps us get a gauge and an idea of what the child likes and how we can better support them. And then they get put to a referral, and that then gets sent to the play specialists. We currently have 3 on theatres, and we put them on our list, and the play specialist will be assigned to each child, and we video call them and just prep them through the phone. If for some reason the All About Me isn't done, we can complete with the All About Me with the parent and the patients, and also get a better understanding on how we can support them on the day. Can you go to the next slide, please? Thank you. On the day of their surgery, they'll come into either the Macmillan Cancer Centre for their day surgery cases or to the Tower. And some of the pictures we have are from, the first picture is from the MCC day surgery cases, and so is the third picture, and that's how we set up for the neurodiverse list, where we have like the rhinosensory trolleys and some of the lovely resources that come from like the Starlight boxes for the sensory and stuff. And then when we have the list on the Tower, we've got the middle picture where we have a sensory room that the children can go into to help deregulate their emotions, or just a nice calm space for them to stay in while they're waiting for their surgery. We'll then further prep them, use the resources and the information they gave us in the All About Me to bring things that they like, allow us to figure out what they dislike so we can better try to avoid any triggers. We have communication with the nurses by a weekly neurodiverse list where we send information about every neurodiverse and anxious patient that comes in, where it discusses like what they have and how they can help them or what they like. And then when they come in, we have discussions with the anaesthetists, the dentists, the surgeons, just to figure out a plan for them and how we can support them, whether it's with pre-meds and how they take their pre-meds. And if they do take it, we have other ways of doing it, such as like the nasal medicines or the buckles.
Geraldine, you're halfway through.
No problem, thank you. We then figure out a way to, like, if they can wait for their surgeries or if they need to go first, and figure out a plan with the anaesthetists. We're included in the MDT meetings in the MCC, just to discuss each patient and their needs and stuff, and we're included in discussions for the steps on the child. And if the anaesthetists do have any concerns or any issues or worries about the patient, then they look to the play specialist to kind of like help them guide on having the patient have a better experience in the hospital. We then work with distraction and use of array of different distraction tools to help, such as iPads, light tools, bubbles and stuff to help them. And then once they have their surgery, we do the post-procedural with them, in whether discussing how the experiences were or just giving them certificates and giving them resources post-surgery. So with our neurodiverse list, we currently have 117 patients on it, and we've currently, from today, we've completed 49 of the cases.
Wow.
We wait to see how when I do the neurodiverse weekly list, I then go to the referral list, see who's coming in for the next week, and that's when they get contacted for the video prep. We've currently have 5 discharged, whether it be the nurses or the surgeons discharging them.
Geraldine, this is amazing. It's no wonder the judges were so impressed. The way, I mean, just listening to those statistics, the way that you've managed to reduce the dental surgery list, and let's not forget that it's the personalization within your work that has meant that you've been able to make treatment inclusive and accessible for all, is what I'm hearing through your personalization. Really super well done. Thank you so much for sharing. Thank you.
Thank you.
So we've reached the end of our 6 speakers. I'm just going to have a quick check to see, would anybody like to verbalize a question? We will have time for one question, and then we're going to move on to really hearing about what is next for these innovation awards. What does it mean for 2026? So if anybody wants to put their hand up, I mean, I'm also dying to ask some of my questions. So I'm just going to jump in then. I particularly want to, I'm just going to also say how just amazed I've been today by the range and the variety of innovations, everything from supporting young people in situations of sexual health, using VR, using the range of different ways to personalize and synthesize technology, and the building on work that exists. Rather than sort of asking a specific question to any of the presenters, actually, I'm just going to allow all the information that's been shared just to percolate and settle, because I think we've heard so much today. I know that this information will be available on our website, and perhaps we can arrange some sort of digital Q&A. But just suffice to say, thank you so much for sharing to all of our speakers. You have been amazing and so generous to share your insights with us. Thank you. So to build on the impact of this work of spotlighting innovation, I'm going to hand over to May. Could you tell us what is next for the Health Play Innovation Awards, please?
Yes, thank you, Laura. I can tell you what is next. For those who don't know, I'm May and the Insight and Impact Manager here at Starlight. And part of my role is to kind of oversee managing the Health Play Innovation Award. And excitingly, we can tell you today that we will be launching the award again. So we've seen all the successes of the 2025 award, and we are going to be running it again for 2026. So applications will open today, and I will talk everyone through a little bit about what you need to do to apply if you're interested, and what sort of thing we might be looking for. So a bit like Susan, I will probably just show some slides and talk through other ones, but it will all be on the recording for people to refer back to. So if you move on to the next slide. We've heard so much today about what innovation is in health play, and just to make it kind of really clear about how we think about it at Starlight, we really think about it in these 3 stages, and we've heard today about so many of the kind of challenges or problems that children and young people or health professionals might face in healthcare. And then so many great examples of how health play can be the solution to those challenges. So when you're applying, if you want to apply for the 2026 award, we really want you to be kind of working through this cycle and really be at the delivery and evaluation stage of your innovation. So you've come up with a solution to a challenge using play, and you've started to test it out and see whether it works, and you're able to show us a little bit of impact as well. Next slide, please. Hannah, there we go. So just a quick rundown of the timeline. As I said, applications will open today. The information will all be on the website, hopefully by the end of the day, and you'll see an apply button as well. Applications will close in February next year, so we are giving people a little bit longer than last year to make their application. We'll have shortlisting in February before the panel of judges come together in March, and this will be made up of a mix of our CEO, Kathy Gilman, as well as people from the health or the innovation sectors. And then from May, we will begin to celebrate the winner and the runners-up with some celebration ceremonies at each person's setting as well. Next slide, please. This is just to sort of reiterate what sort of applications are we looking for. So as I said, you must have sort of delivered your innovation to some extent, and we're saying within the past 6 years, and that's just to make it kind of relevant for the time that we're in at the moment. You must have used play to address a challenge in your setting, and your innovation must have positively impacted children's healthcare experiences. And I'll talk a bit about how you show that in a minute. Just some practical things. Applications are open to any individual or team of healthcare professionals, and you can apply directly yourself. So you don't have to be nominated like you might be for some of our other awards. You can just put your application in yourself. Next slide, please. So if you're interested, what do you need to do to apply? There are a couple of things we would recommend doing before you sit down and kind of make your application. One is that we've got loads of guidance on our website. We've got some frequently asked questions. So if you're thinking of a question, it might be on there. So check it out. We also have an example application form. So this will help you to see the questions in advance that you will need to answer for your application. But also, if you can't find what you need on our website, please just contact us at that email address and we'd be more than happy to support. And then second and thirdly, it's about kind of collating the information that you might need for your application. So there's a question in there around evidencing your impact and how you've measured, how you know whether your innovation has worked. So you could provide us with some testimonials or quotes, some stats, which we've seen some really good examples of today. You may also want to upload photos or videos of your innovation being delivered, and that will help the judges to kind of see your innovation being delivered, bring it to life for them really. So just consider kind of collating that information before you make your application. And just to say, in the red there, you just must have suitable permissions and consent to share anything with us as well. And then finally, again, this is going to be sort of for reference. I won't go through all of this now, but I think it's really important to make sure that we're being really transparent about the way that the judges will choose a winner and a runners-up and the runners-up. And so they will kind of work through this criteria on the screen. So they'll consider 5 sort of areas. The first one being kind of how innovative is the project, kind of have they seen this thing before? But importantly as well, it doesn't matter if they have seen this thing before, it's about whether it's innovative within your setting. So have you kind of overcome a challenge that's specific to your setting and showed that innovation in that way? So don't worry about not knowing everything that's happening within the sector. Secondly, have you been able to evidence the impact? Thirdly, is your project kind of inspirational to others? Would it inspire others to do the same thing? Is it scalable? Could it be picked up by someone else and kind of put into another setting? And is it aligned with Starlight values? And you can see the values on the screen there. So that was, again, a bit of a whistle-stop tour, but on the final slide, you can see the link to the website and the email if you'd like any support with applying for these awards. And yeah, please just get in touch if you have any questions. Back to you, Laura. I think you're on mute, Laura.
I'm muted. I'm muted. Just the final thing to say is thank you so much, not only to all the very inspiring applicants who are out there across the country doing this amazing work. And yes, please do read Adrian's comments. Completely chimes, and we all agree with that. But also to the team who've been working tirelessly to put this project together and make sure that we are able to see those innovations. Collectively, we are doing such amazing work together, and we are in such brilliant company. And let's remember that at the center of everything that's happening here are children and their families whose experiences and lives are being improved with this work.